So basically, just a reminder, the first part, which we just discussed, part A, is 15 minutes and is 20 questions. Okay, so it is very important, and you should not panic. If you don't know something, just skip it and look at it later, like I did. You see, I wasn't sure if the first question is A or B or C, so I just say, okay, for now I say B, and then I go back and look later. Okay, and if you don't know something, just write something. Just don't panic. Okay. So half the examination is part A, and then the other half plus 2 is part B. Now remember, of the 42 questions, okay, we have 42 questions, but out of these, sometimes 1 or 2 might be a test question. What does that mean? What is a test question?
I don't know.
Okay.
Choice.
I think it is, for example, it doesn't score, and they check for other.
Exactly. Exactly. So sometimes questions are put there as a research question. Okay. And sometimes they put a question there to have an estimate of how difficult the exam is. Okay. And for the purpose of standardization. Okay. So some questions might not have any marks, but we don't know. So what I'm saying is, don't get stuck on a question. If you don't know it, just write something and just carry on. Because you don't have any negative marks. Even if you write something wrong, that's fine. You may lose the mark, but you wouldn't get any negatives. Okay? So don't get stuck, and just look at all the questions. Right. Part B, as we discussed, is actually reading for gist and purpose, and sometimes function. And what does that mean? Let's go and see. Could you remind what gist is? Because I think I wasn't here last time. Somebody say what gist is.
The main idea.
Mm-hmm. The overall concept, okay? The general idea.
Mm-hmm.
Yes.
Okay, and it's not about one part of the text. Right. Like this one. Now, what I suggest you do here with the multiple choice questions is actually just read this bit, okay? Just read the root. Don't look at the options, because 2 of them are distractors. So we don't want to be distracted, okay? So it says there, the manual informs us about that the blood pressure monitor, okay, it's about blood pressure monitor, yes? And the manual informs us what? Okay, let's skim very quickly. Instruction manual, digital automatic blood pressure monitor, electromagnetic compatibility, increased use of portable device, medical equipment susceptible to EMG interference, incorrect operation, create potentially unsafe, regulate the requirements of EMC with aim of preventing unsafe product situation. This is standard defines levels of immunity to electromagnetic interference, as well as maximum levels of electromagnetic emission medical device. This medical device conforms to this and this for both immunity and emission. Nevertheless, care should be taken to avoid use of monitor within 7 meters of cell phones and other devices generating strong electrical or electromagnetic fields. Okay, then we go there. So the manual informs us that the blood pressure monitor is likely to interfere with the operation of other medical equipment. Is it correct or incorrect?
Incorrect.
Incorrect. Why?
Because it is about the safety of how we can save the blood pressure monitor, I think.
But there was something about interference. You remember?
Yeah.
It was here, interference. Okay.
Yes, there was.
What does it say? It's likely to interfere with the operation of other medical equipment. Right. Well, I come down here. So, is it right or wrong?
It's like
Okay.
Right,
It's
likely and
wrong.
was susceptible because of likely.
Okay. Right. Did we have other medical equipment here? Portable electronic devices. Okay. Portable electronic devices can cause electromagnetic interference. Okay.
Here said that other devices interfere, not the medical.
Thank
It
you.
says, I think the vice versa.
Okay. Okay.
Yeah.
So portable electronic devices such as mobile phones can cause they can cause what? Interference.
Interference with medical equipment.
Okay. What does this say?
It says
This.
that other medical equipment.
Okay. Good.
Yeah.
Okay. So this one says other medical equipment causes interference with medical equipment. Okay. So how did they distract us? What did they do?
With interference. With one word.
Okay.
I
So
think it replace cause and
yes,
Effect.
effect.
Change
cause and
the
effect.
effect and
Yes.
Okay. So they changed the cause and effect. But you see, they're using the same words. Okay, is likely to interfere. We have interference here. Operation of other medical equipment. So this is not the case. It's actually other electronic devices interfere with medical equipment. Okay, so first one is wrong. May not work correctly in close proximity to other devices. Okay, is that correct?
Yes, I think.
It could be, yes.
Yeah.
Should be considered safe to use in all hospital environments.
There is not any issue about this hospital environment.
Okay.
Not
Not given, for example.
Okay. So it can be potentially unsafe situation in order to regulate blah blah blah, and okay, this medical device conforms. Okay, now so there is nowhere in this text saying that it is safe to use in all hospital environments. So basically, it is not mentioned at all. Okay, so the first one is wrong. The third one is not mentioned. So that is the correct answer. They may not work correctly in close proximity to other devices. Okay. Any problem? So you see, one of the ways of distracting is to change the cause and effect. Right. Let's look at the next. And what can cause? It can cause risk of regurgitation, respiratory aspiration, and the people can have complications. The people who can insert is registered doctor or nurse who has had a training, and those who are not needs to be supervised. Those who are not registered, they can't do that. Okay. The notice is giving information about ways of checking that an NG tube has been placed correctly. Correct or incorrect?
Not exactly.
Okay, it doesn't actually talk about correctly placing that. Okay, it doesn't say anything about checking. Does it say how we check? No, there's nothing about ways of checking. How the use of NG feeding tubes is authorized. Is that correct?
Yeah, I see.
The use
Yeah.
of them, the use of it is authorized or insertion.
Insertion.
Okay. Which staff should perform NG tube placement? Okay.
It's correct, but it's only one part of the main
Yes,
idea.
but it says the notice is giving information about. It's not asking about the main idea. Okay. Right. It's not asking the main idea of the whole thing. It says so. It does say which is staff. Okay. It says registered doctor or nurse. This one is not right. Why? Because we say the people who are authorized. Okay. So not the use of feeding tube. Okay. Not the use of. Insertion is authorized.
Doctor, what's the meaning of authorized here?
Authorized means permitted, means allowed. Okay. For example, there's a section they say authorized personnel only can enter. So it means that only people who are allowed, or not everyone. Okay. Any problem? The C is correct. Yes. So the use of NG feeding tube is authorized. It doesn't say what are the indications of NG tube feeding. Okay. It doesn't talk it doesn't say anything about that. It says how this should be inserted. Okay. Any problem?
Doctor, this type of questions are a little hard. And
yes, because you cannot answer based on one part of the text. You actually need to skim the whole the text very quickly. Okay. If you read these at first, you will actually be distracted. You might make a mistake. So just read the first part, the root of the question, then go and skim very quickly. Now, the quicker, the better. There are 6 questions. Yes.
When we know that the question is about main idea, not only one part, I have seen a lot of questions that like this. That one of the options were only some a little part of the whole whole notes, and then it wasn't the correct.
Okay.
You know what I mean? I think that I couldn't understand when does the question is about whole main idea, the whole idea of the whole note.
Okay, so it says now here it says the notice is giving information about what? Okay, so if it says what is this text about? Okay.
Okay.
For example, it says what is this text about? Then that means the main idea. Okay. But it says manually informs us that blood pressure monitor. So actually, you need to complete the sentence, right? So it doesn't actually ask you what do you think is this about. Now, if it asks me what is this about, I would say it's about NG tube insertion, and
The ways to check.
and complications. Okay, or prevention of complications. Okay, so it's NG tube, NG feeding tubes, and prevention of complications. Okay. So this one, what all staff involved in the transfusion process do? Okay. Okay, what should they do in transfusion? All the staff. Okay, let's see. Right patient, right blood assessments. Okay, right patient, right blood. Administration of blood, significant morbidity, mortality, introduction, right patient, right blood, safe policy, staff involved, must be competency assessed. Ensure safe administration, intended all staff aware of responsibilities with professional standards. Staff must ensure any part in transfusion process. A competency assessment is updated every 3 years, ensuring united mandatory training identified for the roles, relevant training courses, clearly identified in Appendix 1, mandatory training metrics. Okay, so can you tell me what all the staff should do?
Doctor, I think we need 30 years or 30 years for reading like you. You read so fast.
Well, okay, that's what I do. I look at the important words: administration, blood, significant morbidity, mortality, introduction, right patient, right blood, safety policy, staff, transfusion process, competency assessed. Okay, so I don't need to read all. I don't need to read in there. Okay. So ensure safe administration, components, intended patient staff, aware of responsibilities, professional standards. Okay, so it's did I tell you about the bike, the example of the bike, or not?
No.
No. Okay, I will tell you later. Okay, so let's see. What must all staff involved in the transfusion process do? Check that their existing training is still valid.
No.
Attend a course to learn about new procedures. Read a document that explains changes in policy.
C, I think.
A is correct.
A is correct. The existing training, yes. It's competency assessed, okay? And is updated every 3 years, yeah? Okay. Now, attend a course to learn about new procedures. Why wrong?
There is no new procedure.
No, not given.
Yeah, there's no mention of new procedure. And document? The document that explains changes in policy. Yeah, there's no document and there is no change in policy. They just need to be updated. Okay. So you can see these two answers are not mentioned at all. Okay. So you don't actually have one wrong. Okay. Right. I'm making you tired. So
no.
No?
No.
Not at all.
We are learning.
You're learning. Okay.
Yes.
Now, I give this example for all the candidates. I say, somebody asks you and say, where's your bike? Okay. And I say, it's in the shed in the back garden. Okay. Do you know what shed is? Shed is a wooden room for storage, okay? Okay, so, and look how many words there are. Okay, it is 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, 9 words. But look how I say it. Where's your bike? Oh, it's in the shed in the back garden. Okay. what did you hear? It's in the shed.
Shed and back garden.
Back garden.
In the back garden. Okay. So what you hear is shed and back garden.
Yeah.
And that's the part of the sentence that we say louder. And these are the nouns and verbs usually. Now here, because verb is, we don't actually stress it. And this is how we use our basically this is intonation. So it's in the shed in the back garden. Okay. Now, many of the Chinese people just speak like that. Okay. So when you speak to them, yeah, they say, I say, well, where is your bike? Shed, back garden. Okay. So you don't have to learn any preposition or anything. Okay. So that is how we skim. Same way here. Okay. The guidelines establish that the healthcare professional should do what? Okay. Extract from chaperones, guidelines for good practice. Remember chaperone? We discussed that. Yeah.
Yes.
Yeah. A person who needs to be attending when you're doing
Procedure.
intimate procedures. A patient is specifically requests a chaperone. Certain circumstances nominate one. Not always the case. Chaperone is required. Question of using professional judgment. This is an individual situation. Offered and declined, clearly documented in patient records. Relevant discussion, and only be present. Physical examination in a position to see the healthcare professional undertaking examination. Healthcare professional should wait until chaperone is left before discussion. Any aspect of patient's care, unless patient specifically requests chaperone to remain. Okay, so remember what happened?
About chaperone.
It's about chaperone. So it's
It
about
said
chaperone.
that then should be chaperone in the visit, and at the last part it said that the chaperone should leave the room before starting the speaking with patient,
That's
unless
right.
the patient wants.
Yes, good. So the guidelines establish that the healthcare professionals should aim to make patients fully aware of their right to a chaperone.
It doesn't say about right.
Okay. So for now we say we don't remember
Evaluation.
anything. Okay.
Yeah.
Evaluate the, so we say it's wrong for now. Evaluate the need for a chaperone on a case-by-case basis.
Yes.
Yep.
Yes.
It says it's often a question of using professional judgment to assess an individual situation. Okay. Respect the wishes of the patient above all else.
It say that even the patient say that I don't want chaperone, there should not be any chaperone in the room.
Okay.
It doesn't say that. I think B is correct.
I think C correct.
Okay.
Oh, if a chaperone is offered and declined, this must be clearly documented in the patient record. Yes, C is correct.
Okay. Right. So A is wrong. Aim to make patients fully aware of their right to a chaperone. It is not mentioned here. Okay.
Mentioned, yeah.
Yeah. So this might be the case, but in this section, in this extract, it is not mentioned. Evaluate the need for a chaperone on a case-by-case basis. And so, does it say it needs to be evaluated on a case-by-case basis? Does it say anywhere?
No, I
It is
don't.
often a question of using professional judgment to assess an individual situation.
Mm-hmm.
Or the first line, a patient may specifically request a chaperone. Or a
Okay.
certain but it will not always be the case.
Okay.
I think it is wrong.
Why?
or not mentioned. I
Okay.
think not right.
Why?
Because the second, it is a question, not evaluate or assess the situation,
Mm-hmm.
and a question of using professional judgment,
Okay.
not evaluate the patients or something like that, the need or something like that.
Okay. And respect the wishes of the patient above all else. Why is this one correct, you say?
Because in the end of the passage, it says the chaplain must go out, but if the patient wants him to be, he should to be.
If the patient asks the chaperone to remain,
Yes,
then the chaperone will remain. Okay.
yes.
So this is a
Uh,
specific, yeah, this is the specific case here. But now tell me, above all else, what does that mean?
first thing in
The most
the
important
the
thing.
most important thing.
Okay, so respect the wishes of the patient in any situation.
Yes.
Yeah.
Does it say here in any situation?
In the third line, doctor, it is said that I read that before. If a chaplain is offered and declined, it means that the patient has the right to decline that.
Yes, but it's not. It doesn't mean that the patient has the power to. We have to respect what the patient wants
Yeah.
above all else. All
But
else. What is all else? Everything else. Everything. So it,
Yes.
it means that everything the patient wants, you have to do that.
Yes.
Now, so if the patient tells you, okay, I don't want a chaperone, and I don't want you to write in your document that I don't want a chaperone,
Mm,
and this is patient's wish. Can I do that?
no.
Okay. If the patient says, well, examine me, but don't write your diagnosis, can you do that?
No.
No. Okay. So above all else means that respect the wishes of the patient above all else. And it doesn't say here. It only gives one example, which is if the chaperone is offered and declined, we have to uh, we have to respect that. Okay? If.
Yes.
So that's only one situation. It's just one example, not all else. Now, usually, if we have all, it's not correct. Okay, so this is a case. Evaluate the need for a chaperone on a case-by-case basis. It means using your professional judgment if a chaperone is necessary, is required, or not. Okay, so and how do I know that? It says it will not be always be the case that a chaperone is required. Okay, so a chaperone is required when uh, using professional judgment. So need for chaperone on a case-by-case basis.
Like this.
Okay,
Yes.
agree?
Yes.
Okay,
Doctor, here
yes,
professional judgment is about professional judgment to see if there is need for chaperone, or
yes.
professional judgment is chaperone.
No, whether to offer a chaperone or not. Okay.
Okay. Okay.
Sometimes you might actually just examine a woman's thigh, for example, okay? But you need to judge whether to offer a chaperone or not, okay? So if you're a woman and you want to look at a woman's thigh, would you offer a chaperone?
No.
No.
No, it's usually you don't, okay? But in the UK you have to. Okay. So that's what I mean. I mean, if there's a man, definitely a man needs to offer a chaperone because even if you're not going to touch that area, you at least you need to offer a chaperone. You need to say because it's a private part of the body, so you need to, which is not usually exposed. For example, if you want to examine someone's chest, you need to ask if they would like a chaperone because basically you are exposing part of the body that is not usually exposed. Okay, so that is the professional judgment whether to offer or not to offer a chaperone. All right. So always say if you're not sure, offer a chaperone anyway. Okay. Right. Okay. Next one. Guidelines require those undertaking a clinical medication review, okay, to do what? Okay, clinical medication review. Okay, annual medication review. If all patients annual review ideal, strive for. Meantime, there's argument targeting all clinical medication reviews. Patients likely to benefit most. At least level 2 medication review. Minimum standard is treatment review of medicines with full notes, but not necessarily a patient present. So maybe the patient is not present. However, guidelines, all patients should have the chance to raise questions and highlight problems, medicines. Any changes resulting from review are agreed with the patient. Also says GP practices are expected to minimize waste, avoid ineffective treatment, engage effectively, prevention of ill health, avoid costly treatment, proactively managing patients' recovery through the whole care pathway. Okay. So basically, this is about medication review, yes? And level 2 medication review, minimum standard, and then patient doesn't need to be there. All patients need to have a chance to raise questions, and the review, the changes must be agreed with the patient. So you can't do that without their agreement. And GP practices minimize waste, ineffective treatment, avoid ineffective treatment, and engage effectively in prevention, and avoid costly treatments. Okay, now let's go there. The guidelines require those undertaking a clinical medication review to involve the patient in their decisions.
Yes.
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 Consider the cost of any changes in treatments.
The cost of any change. Maybe.
Recommend other services as an alternative to medication.
Not mentioned.
No, no.
Okay, so yeah, so C is obviously wrong because it hasn't been mentioned. But from A and B, what do you think?
A. A is the main idea, Dr. I think.
Okay. So why B is wrong?
Not any change.
Okay. What is it actually mentions cost here to minimize waste in prescribing and avoid ineffective treatments. Okay. And avoid
Avoid the need for costly treatment.
treatments. Okay.
Yes.
So, but it doesn't say that you need to change treatments or medications consider cost because of cost. Okay, it doesn't say that.
When the
So-
drug is approved, we shouldn't change it.
Yeah, so I mean the reason for change is not
Yes.
cost.
The-
Okay,
Yes.
we don't consider cost to change it. Okay, so basically A is correct, to involve the patient in their decisions. Any problem here?
No.
Right. Purpose of this email is to, okay, we want to see what purpose of this email is. Email to all staff. Advisory email. Safe use of opioids. Oh, that's the purpose then. In August, a letter was issued. Safe use of opioids. Hospitals. Incidence of respiratory depression. Post-surgical. 0.5% every 5,025. Failure to recognize respiratory depression and institute timely intervention. Cardiopulmonary arrest. Brain injury or death. Retrospective study. 14,000 something cardiopulmonary cases showed 44% were respiratory related, 35% general care floor. It is therefore recommended post-op patients continuous monitoring, not spot checks of both oxygenation and ventilation. Okay, so basically it says the safe use of opioids and yep. Okay.
Yes.
Posture.
The purpose of this email is to report a rise in post-surgical complications.
Not rise.
Why?
It says only the numbers. It didn't say that it has been raised.
Well, it says post-surgical patients. Yeah. This reported the incidence of respiratory depression among post-surgical patients to an average 0.5%. Explain the background to a change in patient care.
No, there is no mention about background.
It is correct. It is correct because it mentioned change instead of a
But
spot
there
check,
to continuous monitoring.
the
Yeah.
last line.
It is therefore
Therefore,
recommended, okay? So it is therefore, it's actually concluding
so
that it's recommended that the post-op patients now have continuous monitoring instead of spot checks, okay? So it's probably B is correct. C, remind staff about procedures for administrating drugs.
No.
There isn't any procedure.
It doesn't actually mention administration. It's just, okay. So why A is wrong?
mentioned. Yes.
Why A is wrong?
Because they asked us about the purpose of this email.
Mm-hmm. Yeah. So it's just in one part of the email, it says the post-surgical patients. Okay. So it's only one sentence or one part. Okay.
And
And
also there, it hasn't said that it's raised. It's only
Rise, yes, about
number.
this.
okay.
It says about the numbers, not any rise. We don't
Only
know.
one number, yes.
Good. Exactly. And actually, it's not about all post-surgical complications. It's actually about what?
Use of opioid.
Yes, and respiratory depression. So this is actually, so both, there is no rise, and it's not all the post-surgical complications, but this is specific, safe use of opioids. Okay? So, yeah, B is correct. So they have explained the background and then they made a conclusion. Okay. Any problem?
No.
Part C. Okay. Right. Usually, part B and C together have 45 minutes. But part C actually is longer, as you can see. The texts are longer texts. So, the skills that are required for this part. Yes.
I have an idea. I think part C is easier than B, but part C, for each paragraph, there is a question, like part B, and the paragraph usually are shorter than part B.
Are they?
You know, each paragraph has its own question.
Okay.
And it seems, I think C is also like that.
Okay. Good. If you think it's easier, that's very good. But it's sometimes tricky. Okay, it's maybe a few of the questions will be tricky. So.
Hard vocabulary.
And not only vocabulary, actually you need to make a judgment. And I mean, once I took I did an IELTS test, and there was a question about the opinion of the writer, and I couldn't answer it because I couldn't get it. And I read the text 3 times, or I couldn't decide. Okay.
Okay.
And finally I got it wrong. That last question. Okay. So, yeah, points of view, opinion, attitude, and inferred meaning. So it means indirectly mentioned. And we do have lexical reference, which we will look together. Okay.